Alright guys, welcome to Nikki MGTV for another military video for all your military video needs. The last video I made about a review of Navy jobs was Master at Arms, and I figured I didn't even do my own rate first. This is not fair. I know you guys were asking about DC, Machinist Mate, this, that rate, and that rate, that rate, and that rate, and this rate, and maybe that rate. I understand. I'm trying to get to all of you guys, and I promise the videos are coming. I'm getting some people in the show that are in that job. I'm getting some people in the show that are in that job. I'm going to be talking about corpsman today because it is an awesome job. It is the largest job in the Navy, and it's the most decorated. You guys are going to go to boot camp, bam, done. Then you're going to go to A school, which is now 4 months, 16 weeks over in San Antonio, Texas. I did not go to that version of A school, so if you ask me specifics, I can't tell you anything because I don't know anything about it. I'm too old school for that. Now, when you're in A school, I've been getting a lot of questions about this, about special operations and things like that you can do as a corpsman. So in the corpsman community, you have an opportunity to do special operation or special warfare opportunities as a corpsman. So such as dive motivator program, you can do search and rescue type stuff, you can do recon corpsman. There's a bunch of different types. If you're interested in that, what you do, you go to the A school, and then they're going to say, is anyone interested in dive motivator or special programs? You're going to do this. Kind of. You're going to have to do some basic tests. They're going to pipeline you if you do well enough, and then you will be in a specific class for special programs. Now, you ain't interested in that. You don't want to do any special programs. Then, you go through A school like normal. Upon graduation, you may be offered a C school. A C school is a specialty in the corpsman field, so it could be orthopedic technician, surgical, pharmacy, psych tech, x-ray technician, laboratory technician. The list goes on and on. Aviation med tech. There's a lot. I should probably just leave a link of all the technician type skills you can do. You will then get orders. A lot of people will end up going to what's called Field Medical Training Battalion, where you will be in another scenario where you are being acclimated to the Marine Corps lifestyle or rank structure and customs and how they do things, because it's different than the Navy. If you were not sent to Field Med, or even if you were, you can be sent to usually a clinic, hospital, medical center, something like that, anywhere that they need corpsmen. Or you could also be stationed to the Marines. I've never seen any corpsmen that have gone straight to a ship from A school. Not very common. Once you are at your first command, where will you be working? Because corpsman is so general. A lot of people end up doing very basic patient care with vital signs, treating patients with a nurse on the floor, doing things like that. If you do go green side with a corpsman, you'll do basic stuff such as sick call, where you'll be seeing Marines as they come in every morning that are sick. Vital signs there, taking in patients, things like that. Going out with the Marines on different evolutions they have going on. The jobs that you can take on besides that, there are also specialties where if you do take on that specialty C school, you will be working only in that specific field. It's not like, hey, free training, and then you can go be a general corpsman again. You're usually going to work in that specific field. Like myself, I worked in the pharmacy because I went to pharmacy technician school. I'm no longer in that field, but when I graduated, I went to pharmacy and I was stuck in that area. My suggestion to you guys, if you go through A school, if there's a technician job that you want already, that you look at this video and you see that you want, take it. Cool, no problem. Now, if you're not sure and you're just going to pick one because it's there, I would maybe wait. Because when you get out to the fleet, when you're a corpsman, you can see specific jobs and what they do and see what they entail. So wait for that. It also opens up the options, because when you're out of A school, you're limited on certain C schools on what's available. Sometimes they can force you to pick a C school if you do well enough, but that's not super common. And usually after that first tour, a lot of people go to shore duties, you'll end up on sea duty with the Marines or at a ship or something like that. And there you'll get a lot more skills. It'll be higher up tempo and workload. The reason why this is such a good job is because it's got the baseline factor of what you would need to move up in the medical field. And a lot of people want to get in, and this is your ticket in. What you're going to be doing are a lot of basic skills that are beyond those of a medical assistant, but they are going to be more like a certified nursing assistant, closer to an LVN, licensed vocational nurse. With those skills, you could then apply that to go into nursing school, med school, and other things. But the credits, you'll have to go to college still and do that whole thing, but you will gain experience and a foundation in the corpsman community. This is also a great job because the quality of life of medical care personnel. We get really good treatment by the Marines. They love us, and if you're good to them, they'll treat you really well. If you're on the ship and you treat those people really well, they'll treat you really well. If you're in the hospital, you're living in a environment that is not very typical to the military, and it's air conditioned, heated, like you're not roughing it in any way, and you're not deploying usually. The other thing is there are a lot of good commissioning programs to become an officer out of the corpsman community. You can be a nurse, pharmacist, healthcare administrator, doctor, physician assistant, and the list goes on and on. But this is the step towards that, where if you stay in long enough and you do those credits, you'll be able to actually go in those footsteps. It's a lot of hard work, but it's very doable. If you guys don't want to be commissioned, which some people don't want to be commissioned, there's something called a independent duty corpsman, which is the highest pinnacle of enlisted healthcare medicine, where you would be an independent provider on ships with the Marines and other various areas that a doctor cannot go. So that's what the independent duty corpsman does, where they'd be responsible for all medical readiness and taking care of all the patients and ensuring everyone's safety, health, and comfort is everything priority set. All right, guys, I hope this was enough information about the pipeline of what you could be doing as a corpsman and what you can expect when you go to A school, what opportunities you have if you got out, things like that. As always, I appreciate the support, guys. Throw a thumbs up on the video. Make sure you like it, and just let me know what you think. I really like doing these videos, so make sure you're showing the support. Subscribe, as always. We are now at 1,100 something. My goal is to get to 2,000. If you're on the road to 2,000, make sure you throw a thumbs up on the video. All right, guys, thanks for everything. I love you guys. See you next time.